is Angela Tincani. I am professor of rheumatology at the University of Brescia in northern Italy, and I am responsible of a department of rheumatology and clinical immunology in the general hospital of my town. I will do a presentation tomorrow morning about pregnancy in patients with systemic autoimmune disorder. This topic is something that I studied for most of my professional life because I am quite sure that for a patient nowadays is very important to have a normal life, and so also a normal familiar life. The main message of my topic of my conference tomorrow will be that we doctors need to admit that these patients can have a family life, and so we have to do all our effort to let them do. The topics that will be important in the next few years is to understand that we can almost totally control, I would not say totally because black and white is never like this in science, but we are able to control most of the pregnancy problem for these ladies. So we can avoid many miscarriages, we can avoid many hypertension during pregnancy and so forth. We also are able nowadays to treat a patient during her pregnancy because many studies have been done on the effect of drugs during pregnancy. So we have to identify those patients that are at risk and treat them and manage and treat them in the best possible way. Well, it would be good that there is one only treatment in the future. I think there will be many treatments. For sure we will have new drugs towards some immunological mediator or some immunological mechanism able to stop the immunological flares. But for sure there are also different kind of help that we can give to our patient. These are the amelioration of the environmental factor, the advice of a healthy life, no smoking, exercising, no overweight, and so forth. So it is autoimmune disease are complex disease and chronic disease. So they need aggressive treatment for the flares, but they also need strict monitoring for the other period of the life of the patient with good advice for their life. I was at each single Autoimmunity Congress since its foundation. This Congress is for sure extremely important for me because it joins people working in the lab and people working in the world. And this mixture is extremely important if you wanted to understand how to treat and manage patients with autoimmune disease. I think that we will find here many innovation, but this is not the most important thing. The innovation here is in your hand. You can go and see and talk with people without any, any difference, any problem. There are many congresses that present innovative work, but in this congress, innovative work is at your hand.